Hey, Larry, with Michigan now leading the country in new cases of COVID-19, a lot of schools and school districts are scrambling to make some changes.
Here are just a few. In Detroit, Renaissance High School has made the decision to go virtual until the 29th of this month. Also, DPSCD as a whole will go remote on Fridays in December to make way for deep cleaning in schools.
And Ann Arbor schools are going to be closed all next week because of COVID and staffing concerns. Rod Maloney live with us now. Rod, we've been seeing this surge. The age group getting hit the worst is a lot younger right now.
Yeah, it's the children, and of course the signs are up everywhere. They want the children in. Now, nothing has been more controversial throughout this entire pandemic than what to do with the children, especially the little ones. And the state today, the Department of Health and Human Services, had a group of doctors going on saying getting vaccinated is the right answer.
Parents worry getting up in the morning, so weighing whether to get their children, particularly the 5 to 11-year-olds, vaccinated is a big decision. And yet this vaccine is different. Usually weight and size matter, but the doctors say not with the COVID vaccine. Mott Children's pediatrician Dr. Elizabeth Lloyd says the vaccine risk is low.
It's true, children are definitely at a lower risk of severe COVID disease, of hospitalization, and of death from COVID compared to adults. However, there's a big difference between lower risk and no risk.
There are side effects like pain at the jab site. That's the biggest. There are also headaches and fatigue, swollen lymph nodes. But for all that, they say,
overall, for this age group, the benefits really did outweigh the risks. And on an individual level, the benefits for most kids will also outweigh the risks.
The only vaccine for the 5 to 11-year-olds is the Pfizer vaccine, and waiting for, say, Moderna to get the green light is a bad idea, says DMC Dr. Lynn Smitherman.
Unlike some of the other viruses, once you get it, there's no data that says you can't get it again. And the other thing is that again, in a long time, because there's something called long COVID, and the thought is that if you're immunized, the risk of you getting this long protracted illness afterwards is lessened if you have the vaccine on board.
Now, there are a lot of questions asked of the doctors today. One of them came from the parents who wonder about what happens to pregnancy. What's its impact on pregnancy? And one of the doctors, in fact, it was Dr. Lloyd, who said that women, because they're pregnant, end up slightly immunosuppressed anyway. And so they say not only should pregnant women get the vaccine, but there is no side effect that's a problem causing any issues with the baby. Back to you.
Rod, you can see, though, after all this, parents still being worried, right?
Oh, they're absolutely concerned. And the thing is, the doctors are saying that if, in fact, you're still concerned after hearing all of this, they say sit down with your doctor or your medical professional to get more information if you have that many more questions.
All right, Rod.